So according to the stage of the pregnancy, the screening can be different stages. So the stage 1 is when you pick it up at 10 to 14 weeks. If the mother presents at 10 weeks, you offer them the first trimester screening. The first trimester screening is very sensitive, and there is more than 80-85% chance of picking up Down syndrome as a risk. And here we are doing nuchal translucency, which is one of the findings on the ultrasound. And we also do 2 markers on the blood, which is a beta unit of HCG and the PAP-A, the pregnancy-associated plasma protein A, the mother's serum. So if there are other soft markers, even on the first trimester scan, like a flat nasal bridge, that can be incorporated, and the mother's age is always counted in. So as I mentioned, the mother's age itself brings up the risk of trisomy, and if the mother is old, there will be an age-dependent revision of the risk. So according to the mother's age plus this findings, you give overall risk. And the risk that you accept, some units use 1 in 250, some units take 1 in 150. The UK screening, for example, takes 1 in 150. So the range that you select will also say how many mothers are going to be included in this risk. If you take 1 in 250, that's wider. So more mothers will be coming up as high risk. If you take 1 in 150, you're filtering out those between 150 and 250 risk. So obviously you have to choose the cutoff that you're using in your area, and then the parent should be aware of this as well, that the risk profiling brings up the risk as high, but it doesn't rule out. Even if you come as low risk, it doesn't rule out the problem. You still continue to monitor the scans as the pregnancy progresses. There are some mothers who don't agree for the first trimester screening, or they don't get in time to the obstetrician to do this. If they come beyond 14 weeks, then we have something called second trimester quadruple testing. So the reasons quadruple testing is less preferable to first trimester screening is because the sensitivity is lower. It's around 70%. And it also doesn't usually pick up the other trisomies like 13 and 18. It's more for trisomy 21. So here there are 4 tests that are included. We have the beta HCG again. We have the estriol. We have the alpha fetoprotein as well. And obviously we have 4 tests included in this plus the scans. And when the conditions are picked up on this testing as high risk, again, the maternal age-related risk is considered as well. So we have to look at that and adjust the risk as low risk or high risk. And then we come to the point of high risk as to what you would do. So we will discuss that next.